So we have a certification that we always have our VA go through, and it's called Privacy Act as well as the HIPAA certification to ensure that they understand how to deal with private information and the consequences of the things if you're not so careful with attending to private information, because we work in the healthcare sector. Every minute things that we do affects somebody's life. Like, we may be doing so very little things, but one mishap can affect multiple consequences. So we ensure that the people, I guess my number one advice is to ensure that the person that you have, number one, understands how important it is to protect data information.
Hey, welcome. So in today's podcast, I have Ann Abrasado, who is head trainer for GP Hero, which is a business based in Australia that is designed to provide virtual assistants for general practices, so general medical practices in Australia. Welcome, Ann, head trainer. Thank you for joining us today.
Pleasure's always mine, Sachin. Thank you for having me today.
Awesome. So let's get started with our first question. All right. I'll be controversial, Tell me, how is it possible for someone who's working in the Philippines, given the privacy requirements, the security, legal concerns, how is it possible for an administrative worker working in the Philippines to actually be able to work in a general practice in Australia? Tell me that.
Yeah, that's actually a lot of base right there, but we already took care of the insurance thing that you guys are somehow worried about. So with GP Hero, whenever we onboard someone new, we always present to them the insurance and what it covers, and it's all detailed in there. In terms of a person not knowing like what an Australian general practice is, and to ensure that you have an effective worker, is that we train these people to become equipped in assisting anyone's general practice. So we cover their training. We ensure that they know what billing is, for example, or Medicare. We also, most importantly, talk about tools to ensure that they're able to assist with whatever task may it be. We have multiple roles, really. We have receptionists that are working for clinics. We have people who are working on the administrative side of things, like understanding those Medicare rejections. We even have an executive assistance for doctors. So I guess to fully answer your question is that we already have prepped everything for the GP offices to ensure that when we present candidates, you don't have to worry about, wait a minute, do we have insurance in place, or do these people know what Australian healthcare is about? Do they know how the setup is? So we already covered everything for the GP office.
Okay. So maybe if we go a bit broader, obviously GP Hero, that's what GP Hero does. If you were just giving advice to someone who wanted to add a team member in the Philippines to work in their general practice, what would they need to have in place to ensure they meet the privacy, security, and legal requirements? Obviously, you've said in GP Hero, you know that's taken care of, but what does that mean, like in practical terms? Like, what are the sort of different things that need to be in place to meet those requirements?
Yeah, so certainly you need to like have a fully trained person first, of course. So we have a certification that we always have our VA go through, and it's called Privacy Act as well as the HIPAA certification to ensure that they understand how to deal with private information and the consequences of the things if you're not so careful with attending to private information, because we work in the healthcare sector. Every minute things that we do affects somebody's life. Like, we may be doing so very little things, but one mishap can affect multiple consequences. So we ensure that the people, I guess my number one advice is to ensure that the person that you have, number one, understands how important it is to protect data information. And then, of course, you need to have that insurance in place. Like I said, we have that in GP Hero. And then for somebody onboarding, they need to have the proper equipment too, and they need to be working in a secure environment. Like nobody's like walking in and out of that door. No one else has access to those information except the person that you're working with, because you have a virtual environment. You're not going to be with them 24/7 or during their working hours at least. And I don't think anyone has the time to like, hey, what are you doing right now, or like, check on them every minute. So you definitely need to ensure that they're working in a secure location too.
Cool. So what I'm hearing is there's training,
Yep.
then there's some sort of certification, so
Mhm.
qualification, proving they've done the training in privacy. The reality is many onshore team don't have any training or certification. And then separate to that, you talked about the environment and having a secure environment. So
Yep.
physically secure. And then is there some technological security as well that goes with it?
Yeah, definitely. You need to ensure that these people, they're not able to access any, like for example, social media stuff, because then, hackers nowadays are getting creative by the day. And so, an example for us is that we have created another layer of security in terms of our IT infrastructure. We ensure that the VAs are very limited in terms of their access to, for example, Facebook. We don't ever allow that. Any other sites that the IT infrastructure has put in place that we feel is like a cyber threat, it is automatically blocked by that IT infrastructure that we have put in place. So it's like it protects basically whatever information is stored in the VA's computer.
Cool. So,
Yep.
someone thinking of doing this, they need to make sure, obviously, they've selected the right person. After
Yep.
they've done that, they need to make sure they've had training and certification in privacy and the legal requirements. Then they
Mhm.
need to have the secure environment, both the physical environment and the technological environment.
Yep.
And then you mentioned something about insurance. So, practices often have a practice indemnity policy that they buy that indemnifies um, their team if were they to make an administrative error. In this setting, you mentioned something about provider having an insurance policy as well. Does that mean you provide an insurance policy that sits alongside the practices policy?
Yeah, and like it's actually another I guess you would call it protective layer for our partner clinics too, is that insurance there, like you said, is definitely that kind of indemnity policy for our partnered clinics too, just to ensure that you're well covered when you're partnered with us. And I guess that's like the main difference when you hire someone who's like going to be working from home, because then you are going to have to protect yourself, and then you're going to think of all the other things too. Whereas if you go with somebody like us who's a VA agency, we already have that in place for you. So all you need to do is like, make that decision if this is something that's going to work for you or not, and if it's something that you're willing to work with, I guess.
So I'm pretty clear on what a practice needs to do in terms of having meeting security requirements, etc. I think maybe 2, 3 years ago or 5 years ago, people were much more wary, and now there's more acceptance and it's more commonplace for practices to have offshore team working. So I understand that. So tell me, if you're a general practice and you want to recruit someone, obviously I know GP Hero is one option, but people may be considering, I do it myself. What are the steps they should go to first of all recruit the person, and then after that, you're a head trainer. So what is the training that you recommend should happen for someone to be competent? Can you tell us a bit about that?
Yeah, of course. So, number one, it starts definitely with recruitment. Like, you need to ensure that you're hiring level A employees. And when I say that, I don't just mean somebody who's so skilled at what they do. You also need to ensure that they match the values that you believe in. Because then, skills, that's easily trainable. Values, that's somehow something that, it's almost like the behavior of a person is something that I always say during training, that it's only something that God can change. So I can't change that for you. So you need to ensure that right at the start of the recruitment, you're already recruiting someone who matches your values, who has the right skills, and at the same time is a level A employee based on that resume that you see there. And then when it comes to training, us at GP Hero, because we're like Philippines and Australia, we have so different cultures. We have very different means of living and the way that we do life. So we start, of course, with the basics, wherein we introduce the Australian culture, of course, talk about time zones and slangs. Funny thing is, you say different things, so we want to ensure that whenever somebody says something, the VA that you're working for won't go like, "I'm sorry, could you just spell that for me?" So that's like a nightmare when you're having a receptionist doing that for you on the phone. And then we talk, of course, about Australian healthcare. We make them understand how Medicare works, how DVA works, and this pension concession cards and any other work cover things and insurances. And then we focus, of course, on just the GP side of things. So we make them understand that these MBS items or these services are normally what's covered in a GP practice. So you would normally have, for example, the MBS 23. This is very common in a GP office. And then we talk about what is the coverage in terms of Medicare in regards to those MBS items, and then the claiming, how it works. And then we progress with tools like we talk about practice management softwares like best practice medical directors, and then the newer PMS in the field right now. We have Clinico, Gen2. There are a lot of PMS in the field already. And then Cubico, of course, HotDoc, Automed, and dialers. And then the rest of the training is focused on administrative skills. So that being time management, which is very important to us, email management, email etiquettes, phone etiquettes, and building that relationship with the client. So we also cover a bit of the three T's that we go by, which is talent, traction, and trust, because that's also very important to us.
All right. And so what I'm hearing is when you're talking about training, what you recommend is that, first of all, people need to be trained about the country,
Yep, of
then
course.
about language, like slang you mentioned. So you sort of go big picture and then narrow down, and then you recommend training about Medicare or the MBS, and then after that you go down to specific items as examples, and then you mention tools. So when you say training, does that mean knowledge or does it mean actually doing stuff that they're trained in? Like, can you talk about that? Like, how long is training typically when you train someone, and what can they do at the end of their training?
Yeah, so in terms of tools, generally our training here at GP Hero lasts for 2 weeks because that's the initial training right there. It's divided into different phases. And in terms of tools, we have knowledge-based training and we also have applications because we have a training environment for best practice wherein you can do anything and not affect any live patient's data. So we talk about anything that you can think of in best practice, really, from creating a new patient to those online claimings to those data cleansing, so anything in best practice. And then we also have a practice tools for the other tools that I've mentioned. We have Cubico, HotDoc, and Automed, just to ensure that this people that we're training understands the tools in and out, like they're not just really imagining but they're getting the feel of the tool as well. So after the 2 weeks, it doesn't mean that the training stops from there because we have a continuous program that we have put in place for when a VA is done with their training. So every day we have communications training wherein we ensure that, in communication, it's not just really how you speak in English, but it's how you communicate it properly to ensure that you got the message and that you are also effectively communicating what you want to say, because that's important in virtual environments wherein if it's not communicated properly, it's not, the communication crumbles. And then I always see this in virtual settings. If the communication crumbles, trust breaks, and then the relationship goes haywire. And then aside from communications in our ongoing training program, we ensure that they're up to date with tools, up to date with any Medicare updates, and that we see them sitting side by side with a tenured VA, observing and then absorbing as much knowledge as they can in preparation for like landing a GP themselves.
Okay. So what I'm hearing is that there's a couple of layers of training that you recommend. There's
Yep.
first the initial, which in your situation, you talk about a 2 week. That sounds like a boot camp or something. It sounds like pretty heavy duty.
Yeah.
There's a lot of work. Is that so? Is that like full-time training for 2 weeks? Is that what you're saying? Like
It is for,
eight,
yeah, it
80 hours?
is like full. 2 week classroom training wherein everybody sits in the classroom, and then after that we send them out into the world into the office to like get a full picture of how it is done live, because it is within those 2 weeks as well that we ensure that they pass their certification, so that whenever they see somebody doing it live, they understand that this is a live patient, so I had to treat this with the utmost confidentiality because I have that certification in place.
Okay. And so that's initial training, and then you talk about ongoing training once they're working. And you mentioned that they actually get in the training period. You recommend that people get to work in a sort of dummy environment, not a real environment. So it's
Yeah.
that's your recommendation, and that because that's how you've done it, and that's how you've seen it work well. So once you've had, so maybe I'm a practice owner. I've approached GP Hero. I've decided I want a VA to work in my business. You've trained someone. Now they're starting with me. What happens next? Like, how do they go from, they've done some training and they've got a good basic understanding to actually doing stuff for me in my practice? How does that work?
I guess that's what differs us from the rest too, because we have like a layer of managers and team leaders that is there to ensure that it's not just you and the VA, but you have extra support just in case. So to answer your question fully, when a new client comes on board and has already selected a VA, they are also going to be assigned a team leader. So that team leader is going to be like their lieutenant to ensure that the VA, you have eyes here wherein somebody checks that your VA is indeed working properly for you. So we start with 5 tasks. I always recommend 5 tasks because you need to give yourself some time and your team really some time to fully adjust to a person working offshore, and at the same time you also need to give this person some time to adapt to your working environment, to your culture, because the number one thing that I always hear whenever I do client onboarding is that I expect this person to be part of my team, even if we don't see her physically, because that talks about cultural fit, which is very important in the business of a GP office. If you don't work well with someone, that's just going to add to the stress of the mounds of tasks that you already have. So that's quite important. So that 5 starting tasks is going to ensure that you get a full field and your team is going to be well adjusted with somebody working offshore, and that this person as well is adjusting to how you communicate, how you handle your team, how to effectively reach out to others in case there are questions and all that. So most likely we ask our clients to start with 5 tasks, and then we enroll them to what we call a 3-month client journey, wherein we ensure that the first 3 months we have a full flight plan for you, so that in the coming months and years that you stay with us, you already know what is expected of a VA, and then what does a VA fully need from you to ensure that this is gonna work, because it's a symbiotic process. It's not just really you're paying a VA, so you go ahead and work, but you actually need to do your part in ensuring that this VA is also set up for success. And it's a lot to think of, to be honest, if it's just you working. And that's why we have in place a flight plan as well as a support plan for any GP clinics that partners with us, because that's truly important.
Okay. And so what your recommendation is, start with a handful of tasks. So you've said
Yeah.
5.
Yeah.
What sort of tasks? So can you give me some examples? Like, do you have some way, like, does it work on a gradient? Like, start with something really easy, then add to it, then add to it. And so that would be the first part of my question. And the second part is, if
Yeah.
you start with 5 tasks, how long does it take until the VA is able to, or the hero is fully able to do all of those tasks? What's the typical time frame?
Yeah, so with regard to the first question, we always ask it during sales. We're in what exact support do you need? Like, do you need someone to help you with phones, or do you need someone to help you with administrative tasks? So if it's for somebody who's like doing receptionist calls, we don't always recommend for our partner GPs to start having these people take the full blast of calls right away. We normally go on a call mapping flowchart workshop with them. Like, we build out an exact call mapping along with So we have like that, a template of that already, wherein we ask questions and then we build out the call mapping flow. We train the person, and then the clinic also trains the person. So that's normally 3 weeks worth of training. And then when a person takes those first few calls, it's not going to be like full impact. It's just going to be like a slow, gradual. Because to me, phone calls is the equivalent of customer satisfaction. So we want to ensure that when a patient speaks with our VAs, they're getting the best of service. At the same time, they're not getting false hopes, but they're handled with 100% accuracy to the highest level of professionalism. And then when it's admin tasks, we normally start with very simple tasks. So just because our salesperson as well has explained this properly, so when they come onboarding with me, they already have a full picture. We have an ultimate task checklist that we normally send out to our partnered clinics, wherein we have listed all of the tasks that we can possibly cover for them. But we normally start with the basic too, because then, like I said, that's like a leeway for your VA to be fully embraced into the culture of the office. So we normally start with scanning and allocation, updating the patient contact, like those next of kin and emergency contact, and then cleaning your contact list, like ensuring that the partnered facilities or specialists that you have the updated email address. So very simple things, data cleansing too. And then we can even insert the complete outpatient verification, like to ensure that the patients coming in for the appointments next day have an updated Medicare and updated IHI, so that it's a one smooth transaction. So with BDI, normally, or the scanning and allocation, normally that's like we can master it in 2 weeks, and then we can gradually increase the number of tasks. And then when we feel like the VA is already comfortable with the 5 tasks, we then recommend that to get full utilization, here is a list of tasks that your VA can do for you.
Okay, so
Yep.
it sounds like you recommend starting simple, building
Yep.
up, and then your normal suggestion is then, because you've got this master task list, and what I might do is I might grab that from you so that viewers or listeners to this in the show notes can access that list. And so
Yep.
you use that as sort of a guide as to where do you want to get started, and then once they've worked on those 5 tasks, you recommend then adding more tasks to it, but doing it
Yep.
bit by bit. And so I get that. The other bit that you talked about that's really important, you said, is around cultural fit.
Mhm.
So can you talk a bit more about that? Like what do you see that what works well, what doesn't work so well? Like what would be your advice around helping an offshore team member fit in culturally?
Yeah, so if I were to go broad, I've been to like working from home environments and working in a facility like this with GP Hero, and I always see that the number one ingredient there is definitely trust for a virtual relationship, I guess, to work. So cultural fit, it's kind of hard to harness if you're just hiring based off on the things that you need. Like, I see amounts of things that I need to cover, so I'm going to hire the next person that's available. So that's not truly achievable. And so what we do here at GP Hero, if I can set it as a guide for anyone out there, is that whenever we onboard a client, we always ask them to picture out the perfect employee. Like, if you were going to hire an employee, can you tell me what your expectations of proficiencies in terms of tools? What are your proficiency expectation in terms of skills? And what are your proficiency expectations in terms of behavior? And then we ask them, can you describe what an impeccable service looks like to us, to you rather? And then what are some of the things that a person can drive you crazy in terms of acting in times of pressure? So those things we already have like a picture of what this person looking for in a person. So some would tell us that I need someone who's proactive, who's very independent, and then some would tell us like I hate it when a person just assumes without coming to me with questions. And then others would like, I would like it for a person to investigate, do everything that they can before they come to me with questions, because I just don't have the time to answer the questions all the time. So things like that helps us. And then what we do is we match those based on the profile. So we do a predictive index behavior, wherein it tells us what this general behavior of the person is. and then we match that with the need of the GP. So we may have like a pool of people that's like ready to be partnered with the GP, but we don't just send the next person available. We always ensure that we have a clear picture of what the GP needs, and then we match you with the right person based on that PI behavior.
Ah, right. So that's interesting. So if I signed up, if I wanted to hire a VA, and you had five available, you wouldn't just offer one of those to me. You would first quiz me and see what my profile is and what sort of personality I need or what sort of
Yep.
skills I
Yep.
need, and if you didn't have those amongst the five on your bench, substitutes bench, if you didn't have those available, you'd then go out and find that person instead, and not just give a default sort of next in line.
Yep. Definitely, because we want to ensure that it's not just the skills, but we're matching you with the right person as well. Because it's always music to my ears. I've had a conversation just with one of the doctors a few months back, wherein she was having an issue with her executive assistant in the first few months, and so I said, hearing to you right now, you're not just actually complaining about the skills, but you're complaining about the behavior of the person, which is something that's innate. And so I said, let's go with another candidate. Tell me, and then select a VA because we think that these people are closely matching to what you're looking for. So she selected one by 2 3 months when I did a catch up, because I normally have a catch up with our GPs to ensure that we're performing up to standards at the same time the relationship is working well. It was just music to my ears when she said, I think I found my right person. So that there is very important to us, that you find the right person, that not just in terms of skills, but you can fully trust this person even if you don't see them like face to face.
Okay, because I think, and I've probably, in the past, I've hired people independently. I've had, in the early days, people work from home, which I understand now. What you've described to me is better that they're in an office environment. And I think I have just sort of hired based on, can you do this task?
Yeah.
And so now I understand where maybe it didn't work so well, because it's also about, if the person has behaviors which don't fit with our expectations, or I think I'll use your words, that have behaviors that drive you mad, then there's going to be a disconnect. Is that something you've always done, or is that something you've learnt over time that you needed to do?
I think it's something that I learned over the years of both testing waters of working from home and working in the an office setting like this, because I found out that if my values and the client's values that I work for doesn't really match, no matter how skillful I am, we are always gonna clash, and then it's gonna create unclear expectations. Like your Don to me doesn't look like the Don that you just described when we were talking, because there's already a barrier of communication because of the unfitness in terms of the cultural fit right there, and then it just creates unnecessary stress as well for both sides. Like, we are going to try and make this work. And so we're going to go through lengths and lengths of, like, time that I want to spend with you. So just to ensure that I don't waste anything. But then to begin with, just because you have the wrong person seated there, that's already a time wasted. That's why to us, it's important that whenever a new client comes on board, we always have that 3 month client journey, because we check on them bi-weekly. Every 2 weeks, we always have a catch up, like, how do you feel like your VA is working for you? Do you feel like the team is comfortable? So we don't just focus on utilization, we don't just focus on the performance if they're performing up to standards, but we look at the impact that the VA is contributing to the clinic. Like, do you feel like this VA has the potential to alleviate more burdens in the future? Do you trust this VA to work on the things that you ask them to do right now? So that's really important.
Cool. That brings me actually to my next thought, which is,
Yeah.
when bringing in an offshore team member, it's natural for a practice owner. I had those concerns about upsetting my existing team, or
Mhm.
and some people will be thinking, oh, you're hiring offshore, so it's gonna create job losses and dissatisfaction amongst the existing team. What's been your experience of that?
I'd be honest and say I never had that like feedback that our receptionists here are losing their minds just because they're so afraid that this person is going to take their job. But here's what I hear from most of the GPs that we've worked with is that their receptionists are now focusing on important tasks that only a face-to-face person can do. So just because somebody is already taking care of the administrative things, like somebody is already taking care of that tethers list, somebody is already taking care of the appointment confirmation, so somebody's already taking care of sorting those emails and answering to those email queries and those files. Somebody's already taking care of that. Now they would tell us that, you know what, our receptionist now has time to fully focus on the things that we can do here, like those face-to-face relationship. Like whenever a new patient comes into the office, the patient is being treated with the utmost courtesy because as the first level of customer satisfaction, we are now more accurate with the files that we have in our office, and at the same time we're giving the time back to our receptionists to ensure that they are working on the things that they have to do. Because the very thing why people come to us is because the team is already drowning in tasks. And so they need someone who's not like engrossed in the middle of the business, but they can take away the amounts of tasks that is in here because I need to focus on important things. So I've never had that, you're taking away our jobs or anything, but if anything, most of our GPs are so thankful with the VAs that we have. Matter of fact, I had just a performance evaluation with Eastbound Medical yesterday, and they were like, please pass on the praises that we have for the two VAs that they have here. Because they were like, our team here, before when they come here, they would like, here comes work again, and I have like mountains and tasks. And then now they like it that they see when somebody comes in the door, like their teammate. It's almost like a breath of fresh air is gonna like come whistling with them when they enter that door, just because the burden is now lighter. Like sure, the burden is there, still there, but it's so much lighter compared to when they hired someone to work on those other tasks.
So that's the team side, the onshore team.
Yep.
There's the other question that always arises for, if you have a VA maybe working on the phones, either inbound calls or calling out, that patients may not like it, or, there may be dissatisfaction there. What's been your experience of that?
I would say, and this is talking in broad, that happens when you do not have a call mapping flow in place. Like when a person picks up the phone and answers that customer on the other line, what irks a customer is definitely someone who's not confident over the phone, right? And that confidence is resolved when you have a call mapping in place, because this person knows, like, if this is a type of call, if it's a for booking, then this is the step that I have next to do. This is the things that I have to ask this patient. And then I have here a list of doctors that can do this appointment. Or I have here a list of steps that I need to ensure that I'm matching the patient with the right doctor for this appointment. So things like that diminishes the fear of that the patient is going to be dissatisfied with the person coming, calling the clinic, because it's a lot to like train a person to take in your inbound phone calls, right? Like you have to ensure that they know everything from inside out, because then when a patient asks, like, you want them to be giving that accurate information. That's why I always say whenever somebody wants to start with receptionist role, you need to come on an a call mapping session with me, so that I can fully explain this to our VA, and that diminishes the like going back and forth. Because I don't know about you, but when somebody calls and like, okay, so hold on 2 minutes, I'm gonna ask someone. That there is already like a pathway leading to an aggravated customer. Like, I am in need of medical attention, or I just need my appointment book. It's just really a simple thing that I'm asking you, and now you're going to put me in hold. Or you're going to transfer me to someone because you think you can do it, because this is just a simple query. So that call mapping flow that we have inbuilt for our partner clinics diminishes all that. And with people here who are doing phone calls, we've never had that issue that they have an aggravated customer to a point wherein they were like, the customer is shouting on the other end. Of course, it's normal that we don't, that it's going to be 100% accurate all the time. I think that's pretty normal in any environment. We're not going to get it right from the beginning, but we're good at catching our mistakes too. Because when you tell us that So we have a customer here. We receive this information. It's not really customers as well, but it's like the onshore team catching this. Like, can you tell this person that the next time this patient calls, do this and that? So we're good in taking note of that and then not repeating that mistake over and over again.
Cool. So really, what in your experience, patients being irritated is more a symptom, not so much of the person on the phone, but the system that they're
Yeah,
following, and it's the lack
yeah,
of confidence in the system, which then comes through as lack of confidence on the phone. And so,
yep,
to solve that, either with onshore or offshore, the key is to have a really solid call map, so you know,
yep,
and the people who are answering the phones or dealing with the phones know how to manage, the various queries and inquiries that come in.
yep,
Cool.
precisely.
So we might take a different turn now. We'll have a bit of fun because I frequent a few online fora
Uh-huh.
and fora. I'm Latin scholar, so I use the Latin plural. One of the things I see online is a serious concern that comes across that, oh, you're hiring people offshore, in this case, the Philippines, it's exploiting offshore workers and it's exploiting them, poor conditions, maybe sweatshop environment. There's pictures that are painted of it being, exploitative and unfair. You're in the Philippines and you lead training and you're in the office and the environment. Love to hear your honest perspective from, not just, we're talking here in general practice, but I
Yeah,
think
yeah.
in all your environments that you've been, like, do people feel exploited? Is that a serious concern?
Yeah, so like this is also a shock to me because if you're somebody from the Philippines, you wouldn't feel exploited to be working in environments like this. And when I say that, like you working for foreign people, that's why back in the early 80s, 90s, up to leading to the early 2000s, the number one thing that a Filipino does is to go abroad, to go offshore, because then the currency is very different and it can support my family. But that also means that I have to be away from my family for number of years. I won't be able to see them and I'm just going to be alone in a country. So to me, and this is coming from the things that I see and the things that I have in my life right now, because of industries like this, I have a better chance at providing better future for my family. Like, take for example, and I'm talking in broad right here, not just for GP Hero. Take for example somebody who has just finished a 2 year degree in college. So back in the day, you need to complete a 4 year degree to come and work for the government, for example, to have better salaries. And so if you only are able to finish 2 years, that means that you'll get the below minimum wages. And the below minimum wage is truly not enough to support a family of four, much more a larger families. And Filipinos, we love large families. And so back in the day, we embraced that we're going to be poor. Sorry for the term, but I don't like it so much. But we're going to be that for forever, for the rest of the generations to come, unless by any chance I win the lottery, then that there can be, or I go into, doing bad things. And so with industries like this coming in place, this second year, the person who just finished second year now has a better shot at gaining more money, the same amount of money that this government employees has. And now I have a better chance at providing for my family. And I see it in effect, like, personally, because of the industry that I'm in right now, I was able to build a house for myself, although it's not yet complete, but that's a fruit of my labor right there. I am not able to, I wouldn't think I would have that, or I may have that, but I'd be like drowning in debt because that's like a huge thing for me. And I'm able to afford better education for my children. My children goes to a private institution, and in the Philippines, it's the public and private institution is quite different. And so I'm able to send my kid to a private institution. I'm able to afford some of the luxuries that I have in my life. And for other VAs, like I've just had a conversation with a VA back then wherein she started with us, her dream was just to have an iPhone. That's it. Like she's a single person, so normally they have like materialistic dreams, and she was like, for the longest time, that's the only dream that I have. And so with her receiving her salary, she was like, the first thing that I bought was buy something for myself. And that to me doesn't talk of exploitation, but that's like giving us hope for a better future to provide for our families, giving us hope to like step up from the current the common situation that some of our countrymen has. So that's like this industry has been always a blessing to us from the time that it was introduced in the country.
Hey, that's been really insightful, Mayan. So thank you so much, Mayan Abrasado, head trainer for GP Hero. We've made a promise of sharing in the show notes the link to the 100 and something ultimate tasks you said that a VA can
Yep,
do. So we'll make sure that's there. Thank you so much for your insights and your honest answers. It's been really enlightening, and hopefully we'll invite you back in the future, and maybe go
of
deeper into
course.
some of these topics so that we can explore a bit more in detail some of those things you've shared with us today. Thank you so much.
Of course. Take care, Sachin.